Hi guys, it's Patrick from Fix You Physio in Sligo and Letterkenny. So continuing on our information videos about elbows this week, we're going to talk a little bit about tennis elbow or lateral epicondylitis. So with our elbow again, if that's my elbow, it's going to be in the same position as my right arm, and the inside knobbly bony bit you can see is going to be the same part as you can see jumping out here. So on the outside of this elbow, or on the outside of this elbow, is where my extensor muscles that run up into my wrist and hand come from this origin back in here. And as I do that, then you should be able to see my muscles in there starting to move, and they continue the whole way down to a common extensor, which is this movement origin. So with tennis elbow, this is your point of pain, and you can have usually a tender bony point of pain. It can come from a lot from overuse, it can come from strenuous activities or repetitive motions, and people present with painful arm, especially when they're trying to lift up a bag or trying to lift up a bag from the ground out to the side a bit. Any kind of grip and motion generates pain back in here under load. So there's lots of causes. Sometimes it can be the tendon where it attaches to the bone, it can be the tendon itself, it can be some of the ligaments, or it can be capsular stuff at the back, depending on how your pain presents. With tennis elbow, generally it's the tendon attachment into the bone or the tendon itself, and has lost the capacity to do work or do the load or repetitive thing you're asking it to do. So with therapy then, tendon research at the minute is saying load it up appropriately and load it up continually. And watch your aggravating activities for the people that present in high sin factors. So there's lots you can do for your tennis elbow, there's lots of therapy you can do, there's lots of rehab you can do, and really you want to load and make that tendon stronger. For people who have had scans on it and there's interstitial tears or there's any kind of small tears in that tendon, there's still good evidence for that tendon can still tolerate a high level of load, so you don't need to be as worried about micro tears or small tears in there that your tendon's done. People with rheumatoid arthritis or inflammatory conditions are predisposed to getting tendon problems. But again, with that you can manage and rehab quite well through it. So if you've got any issues or questions about tennis elbow, or if you've got any problem with your elbow or elbow pain, message to our Facebook page and we'll be delighted to get back with answers.